Hey everyone, today we're going to break down something that's been developing kind of under the radar, but its impact, well, it could reach every single one of us. We're talking about some big proposed changes to the VA healthcare system. So let's get right into it.
You hear this a lot, right? The whole debate is often framed around giving our nation's veterans more choice. But what if that choice had these huge, unintended consequences? What if it set off a domino effect that could actually weaken the entire American healthcare system? That's the question we're going to explore.
The way our sources describe this whole situation is as a perfect storm. And that's a great way to put it, because it's not just one thing. It's a really dangerous combination of two massive policy shifts that are happening at the exact same time.
So on one hand, you've got these major budget cuts that are threatening hospitals all across the country. And on the other hand, there's this big push to move millions of veterans out of the VA system and, you guessed it, right into that same private healthcare system. Let's see what that really looks like.
Okay, to really understand the impact of that second force, moving the veterans, we first have to get a really clear picture of the system we're talking about. So, for just a minute, let's put the veterans issue aside and look at the state of American healthcare in general.
So what does the American healthcare landscape look like right now, today? Well, honestly, the numbers paint a pretty stark picture. We're talking about a system that is already stretched to its absolute limit.
Now, this is what's really wild. 89%. We're not talking about a few isolated pockets here and there. This is nearly 9 out of every 10 counties in the entire country already struggling with a lack of healthcare providers.
And listen, it's not getting any better. The system is actually on track to be short over 100,000 doctors in the next decade or so. And think about it, you can't just snap your fingers and create a doctor. It takes years and years of training.
The crisis is especially bad when you look at mental health care. 123 million Americans, that is more than a third of the country, are living in a mental health desert right now. For so many people, finding care is already next to impossible.
And for folks in rural America, the system isn't just strained, it's literally disappearing. I mean, since 2005, 193 of these crucial local hospitals have just shut down, and hundreds more could be next. When they go, there's often nothing else for miles and miles.
Okay, so that's the reality of the private healthcare system. It's already stretched thin. Now, let's bring in the second part of our perfect storm, the idea of adding 9 million veterans into that exact same system.
And the source material is super clear about this. This isn't a political argument, it's not a matter of opinion. It really just comes down to basic, undeniable math. You've got a container that's already full to the brim, and you're trying to pour even more into it.
This quote just nails the core problem. The capacity just isn't there. And when you overload a system that's already overloaded, it doesn't just affect the new people coming in, it makes care worse for everyone. Wait times get longer, quality goes down for all of us.
And you know, it's not just a numbers problem. Veterans often have incredibly complex service-related health issues. We're talking about things like PTSD, traumatic brain injuries, toxic exposures. These are conditions the VA has spent decades specializing in, but which your average private sector doctor just hasn't been trained to handle.
So this is the crucial point, the part of the story that almost nobody talks about. What happens if the VA is weakened? It's not just about veteran care. And this brings us to what might be the most important and least known piece of this entire puzzle: the VA's massive foundational role in training the people who provide your healthcare.
Okay, just get a look at this number. 70%. No, that is not a typo. 7 out of every 10 doctors practicing in the United States today got some of their medical training inside the VA system. It's an absolute cornerstone of American medical education.
And it goes so far beyond just doctors. The VA is basically this giant teaching hospital for over 40 different healthcare professions. We're talking about the nurses, the pharmacists, the social workers, the people who staff clinics and hospitals in every single one of our communities.
And hey, remember that mental health crisis we talked about? Well, the VA is one of the single biggest forces working to solve it. 1 in 5 of our country's future doctoral psychologists gets their crucial hands-on training at the VA. It's why groups like the American Psychological Association have praised the VA's commitment to training the next generation.
This whole process, it's called graduate medical education, or GME. It's that essential residency phase where new doctors get their real-world skills. And the VA is so central to this that the Association of American Medical Colleges literally calls its role irreplaceable.
So you can probably see where this is going. When you talk about defunding or downsizing the VA, you're not just talking about a healthcare system for veterans. You are talking about dismantling the very factory that produces America's healthcare professionals.
So let's bring this all together. Why does a debate about veteran healthcare matter to you, to your family, to your community? This is the final critical piece of the puzzle.
I mean, this quote from the source material just says it all. You cannot solve a provider shortage by cutting funds to one of the biggest provider training programs in the entire country. It just doesn't make sense. It makes the national crisis worse for every single one of us.
And this completely reframes the whole issue, doesn't it? The conversation stops being just about a specific group's benefits and becomes about the health of our national infrastructure. The stability of the VA is directly tied to the future supply of doctors and nurses for the whole country.
So, as we wrap this up, this is the question we're all left with. And it's personal, it's profound. The question isn't just who will care for our veterans. It's who will train your doctor. Because the answer to that question is going to shape the future of healthcare for all of us. Thanks for joining me.